Dr. Michael Kachmar, a podiatrist out of New Jersey, specializing in surgery of the foot, ankle, and lower legs, says that venous or varicose veins are prevalent in patients seen in the BVI, and the numbers are alarmingly higher than in the U.S. Speaking on a special episode of JTV's talk show Spotlight, Dr. Kachmar said that the main problem existing in the BVI in terms of foot disease is varicose veins, where veins in the legs or feet have become enlarged.
Well, the biggest thing, as I said, is the vein disease, the venous disease that develops into ulceration. And these are very debilitating diseases. You'll have an open sore on your ankle or your lower leg, and they drain, and they're constantly in need of care. Most of these people that I see are going to the clinics that do an excellent job treating these wounds 2-3 times a week, and they've been going there for months, if not years.
Dr. Kachmar said that in the U.S., of every 100 patients he sees with foot problems, 10% of them suffer from enlarged veins. However, in the BVI, he is witnessing the reverse, as 90% of his patients have varicose veins. Dr. Kachmar explained how the problem occurs, the most common contributory factor being reflux due to damaged valves.
The blood going down the arteries is pumped by the heart, so it's a pressure that pushes it down. The blood gets back to the heart by way of muscle contractions. The muscles, when you walk, squeeze the blood through the vein, and the blood goes up the vein. Now, when you stop walking, the blood wants to go back down, but it usually doesn't because there's one-way valves. Now, if those valves are damaged, you'll get what's called reflux. The blood will go back down. It creates pressure in the lower extremity. The leg starts to swell. You start to get discoloration. And because of the blood stagnating there, it creates an unhealthy environment where you start to get minor skin infections. If a little scratch won't heal, and before you know it, it gets bigger and bigger. The skin changes, more discoloration, and then you get a break in the skin, and now you have a festering wound we call an ulcer. So it's the backing up of blood. And we call that venous hypertension or venous reflux, and that's the disease process.
Despite the severity of the disease in some cases, Dr. Kachmar gave the assurance that varicose veins are treatable, and the procedures are available and performed here in the BVI and are based on the level of the disease.
With the new technology that we have today and the procedures that we do, it's easy to take care of these patients. It's very low risk, and a lot of them, over 80%, 90%, are cured. We eradicate the disease process.
Foot, ankle, and lower leg disorders are among the most widespread and neglected health problems affecting people all around the world. Dr. Kachmar provides podiatry service from the Seacows Bay Clinic and is contracted by the BVI Health Services Authority.